oh good, she's recording, is Melissa Fernette. Melissa was in the LEAP class of 2017. She lives in Franklin County, has moved from Greenfield to Bernardston, but I won't hold that against her. She has been at Baystate Franklin for 10 years, has also worked at Cooley Dickinson. She is a nurse manager at Baystate Franklin, and as a nurse manager, has seen firsthand what is happening with this pandemic. She has also been involved in labor negotiations and had a lot of tricky things that have called upon her as a leader. So we are excited to have Melissa share her insights, how she has led during the pandemic, how we can support some of the healthcare heroes that are still at it and will be at it for a while. And how are things unfolding right now? Because I know the pandemic looks different than it did 6 months ago. So I'm going to turn it over to Melissa, and thank you so much for joining us.
Absolutely. Thank you, Laura. And thanks for inviting me to do this. As Laura mentioned, you know, this is a perfect timing of this leadership luncheon because we are right kind of in the midst of things. I was mentioning before people joined that at Baystate Franklin, we're getting ready to kind of ramp up, we believe, for kind of our second surge. We were kind of smooth sailing through the summer months, which was nice. We had no COVID positive cases since the end of April up until just a few weeks ago. So we did get a good little break at Baystate Franklin specifically. The other Baystate hospitals had positive cases all along, but we were lucky up in Greenfield at least. So I did put together a little PowerPoint that I'm going to attempt to share my screen, and hopefully it works. I practiced with my husband, so he's the tech one of the family. So hopefully I'm able to do this and you'll be able to see it. Let's see. Can you all see that? Yay, okay, awesome. So I'm gonna go through this quickly, and then I'm gonna open it up to more of a discussion format. I was kind of talking with some of my friends and my husband and saying, if you were not on the front lines, what would you want to hear about from somebody who is on the front lines? And they kind of looked at me like, I don't know, I hear about it all the time from you, so I don't know what to tell you. So we're going to wing it and let me know what you further want to hear from me. So just a little bit about me. So I grew up in Vermont, right over the border in Vernon. It's a very small town south of Brattleboro. I am a wife. I'm a mom to 2 girls. They're 4 and 11. And I was telling Laura and Jess that I've kicked them to other places in the house because I'm actually home today and not at work, which is not a usual thing for me. I've always loved helping people all throughout my childhood and my teen years. I always did volunteer work, or I was part of the Girl Scouts, so helping people through that. Pretty much anytime I could help people, I was doing that. Right after high school, I decided not to go right into college, and I became a certified nursing assistant, so a CNA, and worked at a local nursing home and then at Baystate Franklin for a little while I decided to go to nursing school. So I graduated in 2007 with my nursing degree from Mass Bay Community College. They actually had done a joint program with Greenfield Community College, which was partially remote, which looking back on that, I'm like, well, it worked then, it can work now. So that's hopeful. And then I decided to go back to get my bachelor's degree and graduated in 2016 from Elms College with that. So I worked as a nurse initially at Cooley Dickinson for a couple of years in their intensive care unit, and then I became a nurse at Baystate Franklin in their intensive care unit, where I worked as a bedside nurse for quite a few years until I accepted a management role about 5 years ago. I will say I never imagined I'd be in a leadership role, but here I am. So, so what is COVID-19? I think we all know what it is by now. It's a respiratory illness, and as we know, it can cause severe symptoms and it can cause mild symptoms. So there's a whole kind of gamut of symptoms that it can produce. and it obviously is a pandemic now. This is just the dashboard off of the Massachusetts DPH website. If you haven't been to that website, I urge you to go there. They have a lot of really helpful information. They post these dashboards pretty frequently. This is the one from actually yesterday, so it's pretty up to date. Obviously, our cases in Massachusetts are changing very rapidly. Every day we see an increase. But as you can see, what I really look at is the hospitalized patients. So there's quite a few in Massachusetts that are hospitalized, 781. And then I also like to look at the patients in the ICU. So that's telling me that they're very, very sick, requiring higher level of care. So 159 of those. I can say as of today, we do not have any patients in our intensive care unit at Baystate Franklin positive for COVID, which is really reassuring. And then you have the average age, which has been kind of what it's been running, that 67, 60s to 70s has been the average age. So starting out at the beginning, so this all started back in March. I think it was actually Friday the 13th, if I remember correctly, that things all started to go crazy for us. So from the beginning, there was a lot of unknowns. We didn't know a lot about COVID. We looked to the Center for Disease Control, DPH, Department of Public Health, for information and kind of guidance on how we care for these patients. I can remember when we got our first patient at the hospital, there was a lot of unknowns. How do we care for them? What type of isolation do they need to be under? What should we be wearing to protect ourselves and other patients? And those answers were changing constantly. As a leader, it was very, very stressful because one day I would go out and tell my staff to do one thing, and the next day I was going out and telling them to do something completely different. I feel like during this time, I lost some trust from my staff, only because they felt like I wasn't sure what I was doing. But I had to stay very transparent. I had to let them know that you're right, I don't know what I'm doing, none of us do, and we're in this together. So I did a lot of kind of remote team building things, reminding my staff that we're in this together. We did hang up this picture here on this slide. We hung up on one of our units with all the disciplines on it, just reminding people as they walked into work that we are in this together, we got this, and we'll continue to kind of fight this fight together. Another thing I did is throughout kind of the 2 months of the big pandemic part, I took photos of my staff while working with their permission, and I put together a little slideshow, which I presented to them around, I think it was mid-June, that just showed them how well we worked together and all the wins that we really did have during this time. There was lots of emotions, even thinking about it and talking about it now. It's a very emotional time. It continues to be a very emotional time, not just for me as a leader, but for my staff. I don't know how many times we would cry. My office is always open at work. If people needed to come in and just kind of let loose, they knew that they could do that. There were many days I came home from work and my family knew, just let mom cry, then we'll have dinner and everything will be okay from there. So a very, very emotional time. Like I said, lots of confusion. One day it was wear this mask. The next day it was, nope, don't wear that mask. That's not going to protect you. Wear this mask. Wear a gown, don't wear a gown. Wear a face shield, don't wear a face shield. It was all over the place of what we should be doing. But the positives were that we did continue to build our team. We're a closer team now because of the early issues that we had in the beginning. And we're like a family now. If you ask any of my staff, they'll probably agree and tell you the same. So personal protective equipment. So this is a picture of one of my night shift nurses. I had to get this shot because this is not a typical kind of get up for COVID, but because we have to be specially fitted for the respirator masks that we wear when we go into COVID patient rooms, if you don't fit into them, Or if, in this case, you have facial hair, you have to use what's called a PAPR. And that is a positive airflow respirator where there's constant air exchange for you. There's a little, you can see his little black belt on the back of that. There's actually a little machine that works the airflow exchange. So here he is with his PAPR on. Typically, if you weren't wearing a PAPR, you would wear eye goggles, a face shield over your eye goggles, a mask, which was the respirator mask, gloves, and a gown. So this is what would be typical, sort of what you would see of a nurse going into a COVID positive room. Some challenges we faced, family communication and visitation was a huge barrier. We do not allow any visitors for any patient who's positive for COVID or who is waiting for their test results. So this can be a big dissatisfier with patients. So one of the things we did a couple things. So we encourage FaceTime visits. So we do have iPads at the hospital that we use where a staff member can go in and facilitate the call so that they can have FaceTime with their family members. I also developed this sign that I'm holding in this picture because we had a family that would stand outside the window on the ground floor, and we would hold this sign up in the window so they knew which room their loved one was in, so that they could feel like they were at least being there a little bit with them. We had in the beginning, as you all might know, a lot of our local nursing homes were hit very hard with this pandemic. And so we got an influx of patients that were positive for COVID, and we experienced a lot of deaths. There was one day that we had 3 patients dying at the same time on our COVID unit. And you can imagine what that was like for the nurses and staff caring for those patients. With COVID, what we saw in the beginning was patients would come in being okay, but quickly change. Their status would quickly change. Their breathing would quickly change, and before we know it, they were unfortunately dying. We felt like there was times when it was beyond our control what we could do. There was nothing we could do to help them except for keep them comfortable. I did make a promise to my staff and to our patients that no person would die alone behind a closed door during COVID at Baystate Franklin Medical Center. And I can say that I think we successfully succeeded in doing that, whether it meant me going in and holding their hand, another staff member going in and spending time with them. I strongly felt like nobody should die alone because it's very lonely, if you can imagine, laying in a hospital bed, your family not by your side, and knowing that you're going to die. We did change our visiting policy a little bit. So if you are COVID positive and you go onto what we call comfort care, we do allow one visitor to come in and be with that loved one, but we have to follow special precautions, of course, because we don't want that family member to then catch COVID as well. So we help them get into PPE, and a lot of times what we noticed and what we found is that these family members were scared to come in. Yes, they had a family member dying, but they weren't sure that they were ready to come in and potentially expose themselves and the rest of their family to COVID. So that was a real struggle. And that's really when those iPads came in so handy so that they could be with their loved ones. We had a patient who died while on FaceTime with their family members, and that was huge for the family. They felt like they were there. They could see the staff member was with them, and they were holding their hand through the entire time. Another fear that, oops, sorry, there's a typo there, but that's supposed to say bringing. Another challenge was fear of bringing the virus home. As healthcare workers, every day, we were like, what can we do to make sure we don't bring this home to our families? Are we protected enough? We were changing our clothes before we came home. A lot of nurses would set up a kind of a decontamination unit at their own house where they would strip in the garage and come right into the shower. There was numerous things people were doing. We were offering hospital issued scrubs so that they weren't wearing their own clothes, really making sure that everybody was protected so that they didn't have that fear of bringing the virus home. So our first Code Rocky, I don't know if you saw in the news about Code Rockies, but a Code Rocky is when somebody successfully leaves the hospital after being there with COVID-19. And so this is a picture of our very first Code Rocky. We would announce it overhead and over the loudspeaker, and then we would play the Rocky theme song while the patient either was wheeled out or escorted out of the building onto their next destination. So this is all the staff in the hospital would form a big line down the corridor and escorted the patients out, clapping and cheering. And this particular one was our first one. And it actually was on some of the news stations, like across the state, which was really exciting. And this patient was so sweet. He was an elderly man, and he was clapping for himself as they were wheeling the stretcher down the hallway to bring him to a rehab facility. So even though that we had a lot of low moments, these moments were what we really needed, is those highlights of where patients did recover from COVID. And let's see. And one of the things I just want to really bring light to is we could not have done what we did without the support and love of our family, our friends, and the community. I can't tell you how many times we had food showing up at the hospital from numerous local restaurants, families. People were continuously reaching out to me, what can we do to help? What can we do to help? At one point, we were getting so much in donations that we ended up sending the donations to other first responders, police officers, to the local nursing homes who are also battling this pandemic too. This is a picture of a sign that I came home to one day that some of my friends had ordered and put up in my front yard. So as you can imagine, coming home to that after a long day of COVID was pretty intense. So I think that is it for my slideshow. So I'm going to just stop sharing my screen so that we can, maybe I'm going to stop sharing it. Let's see. Stop share. There we go. All right. So as far as kind of where we're at right now, I can say that like I said, we had a really good summer. I think part of the concern this summer was we didn't have a lot of patients, period. So the hospital was struggling because our patient census was so low. Because patients were fearful to come to the hospital, I think mostly because they were afraid to catch COVID. Sorry about that. So now we're starting to see an increase in our patient census. We are starting to see positive cases come back to the hospital. And so we are, according to Baystate Health as a whole, starting to see a surge again in COVID cases. We've learned a lot from our first surge, which is really valuable. So we know what kind of equipment we need. We know what kind of isolation is needed. We've organized our units at Baystate Franklin to accommodate the COVID patients so that they are separated from what we call quote unquote clean patients. And so that way we are ready. So right now, I believe we have 2 patients at Baystate Franklin that are positive cases. What I am noticing is patients are less sick coming into the hospital with COVID-19, which is really nice to see. But I don't know that that's going to be the case long term. Early on in March and April, when we had positive cases, we didn't know exactly what they needed for treatment. So now we do. Is it perfect? By all means, no, but we definitely know what their needs are more so than before. I would say back in March, we would quickly put somebody on a breathing machine if their breathing got worse. And now we give them other medications and support their breathing in other ways because we have learned through the pandemic. Sorry, goes my dog barking too. The joys of working at home today. So I think I'll pause there for a moment and just ask if anybody has any specific questions about anything I've talked about so far or things that you're curious about.
I was wondering, I mean, knowing what to do must have been plenty hard enough with, how quickly moving it was and how little people knew about it. What was it like having the extra barrier of having the CDC being interfered with and politicized and undercut? Would that make it even more challenging when you weren't quite sure to know which agency to listen to? Or
Yes, yeah, very much so. And I think too is the staff were going to different resources and different agencies. And so they would listen to one and then come back to us and say, well, so and so said we should do this. So why aren't we doing this? So our hospital administration, actually at a system level, really had to put their foot down and say, this is the guidelines we're following. And yes, people can look other places for information, but while you're here in the hospital, this is what the expectation is. But definitely very challenging. And, we're a union environment. So we actually have 3 unions within Baystate Franklin, one being the nurses union. And that also became a challenge at times because, it was sometimes made into a political thing when it really didn't need to be. We really needed to all kind of gather together and do what we needed to do to care for our patients. But sometimes that would get in the way. Great question.
one of my jokes at work is the great thing about standards is there's so many different ones to choose from. And obviously that really doesn't work for a nursing environment. You really need to have one set of standards and then have everyone follow those.
Exactly. And the tricky part, there was times when some of us in the leadership team might not have agreed with the standards that was being set forward, but it was our job to, make sure we're rolling those out and trying to convince our staff that that is the right thing in the moment, because that's the best we know. Whereas now I feel like we're in a better place. The staff is in a better place to know what's expected, what they need to be doing to keep them and our patients safe.
Melissa, do you think that talking about your staff and staff cohesion has it gotten harder, gotten easier, gotten better? It seems to me that, when a crisis is new, people want to pull together. But once you're kind of in it for a while, it gets to be this kind of routine, been there, done that. And then all of a sudden, I imagine something happens when you got to pull together again. And I think that's where leadership really counts a lot. And I just wonder how you experienced that and how you dealt with it.
Yeah. So in the beginning, everybody, like you said, everybody banded together. I think through the summer months when we weren't seeing any COVID patients, staff were realizing that they were burnt out. There was a lot of both home and work stress. And then moving into the fall, people were experiencing all different kinds of stressors. We knew that there was going to be another surge coming. People were dealing with school issues with their children, whether it be that they were remote schooling or needing to make those decisions. Some people, their spouses were losing their jobs. So there was a lot of other stress built up on top of the COVID-19 pandemic. So really what it led to is me talking about that at every staff meeting. I hold monthly staff meetings and I hold them more frequently if needed, and really talking about caring for ourselves and for each other and realizing that we're all in different places during this time and that we're all dealing with so many different things. And just to be aware of that and realize we're still a team, we need to work together as a team. And you might come in someday and you never know what the other person's going through. So just being mindful of that and know that they could be going through something horrible and we just need to be there for one another.
Melissa, you've said a bunch of times that you and your staff knew there was a second surge coming. What were the factors that were considered when you were coming to that understanding? And I guess a follow-up question would be, given that knowledge, what can we be doing better to help mitigate that surge?
Sure. So there was a few different factors. People much higher than me who have done lots of research on this saw it coming, but we also did. You know, numbers have slowly increased across the United States. States that weren't experiencing high numbers are now experiencing very high numbers. And I think people got very lax over the summer months. I think there was more gatherings. People felt like COVID wasn't as prominent, so we can have big gatherings, or, you know, there was numerous big weddings and celebrations. And unfortunately, not everybody is willing to wear a mask, practice social distancing and all of that. And that unfortunately leads to another surge in our numbers. And with the flu season coming too, we don't know what that will look like mixed with COVID. Right now, our flu numbers are very low at Baystate Franklin, which could be because everyone's wearing masks, which is great. But we still are going to see those numbers. And I think what everybody can continue to do to help kind of decrease this surge is just that: wear your masks, practice social distancing. With the holidays coming up, it makes me very nervous. I think people are going to say, well, family is family, we're still going to get together, and that's where we're going to run into issues. So people need to look for alternative ways to spend time with their families, whether it be virtually. And, you know, there's a lot of little memes out there that say, like, I can't remember exactly what it says, but something about don't spend time with them this year so that they're there next year, or something to that nature. Because it's true, it takes one person to spread it to other people. And so we just have to be mindful of that. Hand washing is huge. Constantly washing your hands, hand sanitizer, whatever you can do to protect yourselves and your loved ones.
Melissa, I've seen a lot about the disparity in numbers between folks of color dying from COVID as opposed to white communities, income. What are you seeing in Franklin County? Is that playing out? I know a lot of ours have been the nursing homes, as you mentioned. But
yeah, I haven't seen that to really hold true here at Baystate Franklin. But then again, we don't have a very diverse population of patients. So I don't really have enough data to make a good judgment about that. A lot of the nursing home patients were just that. And those were a lot of the deaths that we experienced were the nursing home patients. Any other? Yeah,
I was just going to also ask, I know in looking at things, it looks, because there's a time lag, right? So it looks like the death rate is a lot lower right now, even with cases going up. What do you guys expect? What are some of the numbers showing going forward as the numbers come up? Are we going to see the same sort of death rate, or is some of that because some of the early was with the older population?
You know, it's hard to say. I think at Baystate Franklin, we're seeing less severe cases, so our death rates will be lower here at Baystate Franklin. I don't know as a system of Baystate what we'll be seeing. It's hard to say at this point because we kind of skated along for a little while and are just getting into that second surge per se. I know the number of patients in the intensive care unit at Baystate Springfield is lower than it was in the past, but still they have quite a few patients there. So it's really hard to say at this point. I think big on the news right now is the vaccine that's coming out eventually. I'm sure you've all heard and been reading up on that. So I think my biggest takeaway on the vaccine is it'll be great if we can get one that's effective. But I think people have to remember that once they're vaccinated, it doesn't mean that they're invisible, that people still need to continue to wear their masks and practice social distancing, because one vaccine isn't going to change the whole situation. And I think a lot of times people think, okay, I'm vaccinated, I'm kind of invisible at this point. So if I could, give one plug for the vaccine, it's, keep in mind that we still have to practice all of these measures in order to keep each other safe.
So my question was going to be about the vaccine, and I guess one question that I still have is, what will the hospital's role be in the administration of the vaccine, and how do you mix that with your existent COVID care and other things that you're doing related and non-related to COVID? It just seems like this is adding another whole role for the hospitals to play in a very complex situation.
Yeah, so there's meetings taking place with the Department of Public Health to talk about rolling out the vaccine. Their intention, last that I've heard, is to offer it to healthcare workers first, and that would take place within the hospital. We don't know at this point if it would mean us giving them to each other. Currently, for the flu campaign, myself and my director vaccinate the entire hospital in Greenfield, so that's a lot of vaccines because we don't have an individual employee health department at the hospital. So we don't know if that will be that the two of us give these vaccines. Personally, I would like somebody with a little more information about them to be administering the vaccines, because as you can imagine, there will be a lot of questions regarding the vaccine. As far as rolling it out to patients in the community, the DPH, Department of Public Health, has been talking about the hospital being a place where patients can, or the community can come to get the vaccine once it's available. But what we don't know yet is how long the observation period will be. So when a new vaccine comes out and you give it to somebody, you have to observe them for a certain amount of time to make sure there's no reactions. So that period could be an hour, it could be 2 hours, it could be 15 minutes. We're not really sure yet. So I think once all of that information comes out, we'll be able to make a better plan as to how we're going to implement this in the community.
What do you know about the sort of storage and transmission of it? Because one of the vaccines I heard, it had to be kept at -80 degrees Celsius, and that's a pretty high bar in terms of storage.
Yeah, so what I've heard so far is one of them, we'll have to utilize dry ice in order to store it. And apparently, I didn't know this, but there's a very big dry ice producer in the eastern part of the state of Massachusetts. So the DPH is hopeful for that. But as of right now, that's what I'm hearing as well, is that it has pretty strict storage requirements, which is concerning for lower income areas of not just this country, but other countries, because they might not have the capability of storing this vaccine.
There's a second one though, right? That does not require the -80 degrees storage?
Yeah, there are two different kind of companies that are working on them. I don't know the exact details because I feel like it changes every day. But I think, one is definitely that dry ice, very low temperature. I'm not sure what the second one requirement is. So it'll be interesting to see what comes out in the end and what we have to do for the vaccine.
Well, there's a little bit of hope for those that live in the rural parts of the world that, I don't know, you've probably heard a little bit about this, but reproduction in the animal world is really big, and it requires storage in -80 degree containers. And so that's how dairy farms operate. That's how a lot of other animal facilities work. And so I think there's probably more of a system out there than we realize. We just haven't tapped it yet, which is probably what you found in the hospital. You probably, as you've gone on this journey, you've probably learned of people with expertise and with experience that you never thought you'd be tapping into, but you are, right?
Absolutely. You're definitely right. And, I think we'll adapt to whatever we need to do. We've shown that in healthcare in the last 8 months. So I know that they'll do whatever it takes to make it a safe vaccine and be able to store it properly.
Melissa, I'm wondering, as a leader of our healthcare leaders, how are you taking care of yourself? I mean, I appreciate seeing the sign outside of your house, but I've been just thinking about this idea of leadership under crisis, and we keep saying it, but we can't be in a crisis for a year or we're going to burn everybody out. And I appreciate that you're helping your staff. Mm-hmm. So what are some of the things that you're drawing upon as a leader?
That's a really great question. So I'm somebody who cares for everybody else and not so much for myself. So I actually finally hit a point about 2 weeks ago where, within a conversation with my direct leader, decided I would take, I just took a week off from work and really focused on nothing but staying home with my family. So I'm on my last day off today. I go back tomorrow. And really just taking time to spend time with my family, knowing that there might be a higher stress time coming into my life very soon if we do go through another surge, and just really enjoying the time together. We had no agenda. A lot of days were spent just at home on the couch watching Christmas movies. Sorry, Laura, that's why I said your kids could come over. And just being together as a family at this point. I think I had a hard time during the early pandemic of caring for myself. And so I finally kind of got to the breaking point where I knew I needed to do something, or else I wouldn't be able to be there for my staff in the end.
Yeah, burnout must be a really important topic because, well, so first of all, nursing is probably still, what, more than 75% female. Mm-hmm. And women disproportionately, taking care of the elder parents, taking care of the kids. The kids aren't in school, the kids are homeschooling, or the kids are remote learning. And, what you're doing is really intense. It's not, my worst day is I have the wrong program on the air for an hour. It's bad, but no lasting effects for anybody, so the importance of what you're doing and the intensity of it, you're trying to stay in that kind of a crisis for a whole year. It just seems like the burnout level for, all healthcare workers, doctors and nurses, that seems like a really steep challenge.
Yeah, absolutely. And one thing I can say, our chief nursing officer at Baystate Franklin is amazing. And she's very much about self-care within her team, and reminding us that if we don't care for ourselves, we can't care for our team. So one of the things she did have us do throughout the summer is take an extra day off per week. And so instead of working, 5, sometimes 12-hour shifts, we would be there for 4 days a week. And it doesn't sound like much, but it made a huge difference, because we just got that extra day home with our family, being able to accomplish whatever we wanted to accomplish at home, and know that we were being covered at the hospital as well. Something we probably won't be able to do for a while again. So that was nice as well. And I also remind my team members, I encourage them to use their time off, use their vacation time. Some people were feeling like they couldn't because what if we got a surge? And I said, we can't live through the what ifs. You have to care for yourself. So if you're feeling like you need time off, you need to request that and do that so that you can be here with us during those what if times.
I guess I have another, this is an unfair question for you, but well, maybe not. Are you or Baystate or anyone you know thinking about the long term? I mean, my sense is that, what you hear about is people are expecting that someday, like a switch, this is all going to be over. And we'll be back to what they perceived as normal. And my sense is, for everything we've all gone through in all parts of our lives, I don't think healthcare will probably ever be the same after this. Mm-hmm. I know, as a consumer of healthcare, as regular, I haven't seen my doctor in a year almost. Everything's been virtual and it's been kind of okay. Yeah. I think the delivery of care, how we respond to crisis. I guess the short version is, has there been much conversation about when this is over, what the future looks like when you don't have to staff a COVID unit, special unit and all that stuff?
Yeah, so there hasn't been a lot of conversation about that, to be honest with you, because a lot of energy and time has been spent in dealing with the immediate needs. However, I can say some of the conversations I've had just within my team is we have not increased our staffing during this COVID pandemic at all. So I still have the same number of employees as I did 2 years ago. We've just kind of had to utilize them in different areas at different times. So I think something that I remind my team of is we're never going to be back to quote unquote normal. I think it's going to be a very long time, if any, that we won't have to wear masks at all times while working in a hospital. I don't think that the vaccine coming out is going to make us just magically go back to a normal environment again. And I don't want my staff to think that either. You know, a lot of them are like, oh, we're getting a vaccine soon. Oh, great. You know, 6 months from now, everything will be fine again. That's not the case. COVID, I don't think is ever going to go away. I think maybe, yes, the vaccine will help, but it might turn into like another flu. We might have a COVID season like we have a flu season. We don't know yet. There's just too little information to know that at this time. But I think it's important for people to realize that healthcare is different and it's going to continue to be different. And I think this has shown that, yes, those virtual doctor's appointments have worked in some situations. So why not continue that? Or what else are we doing differently now that works that we can continue to do? So I think there's going to be a lot of discussion in the future about that. And they're looking too, healthcare is looking more at a community health, how do I describe it? Kind of community health, I'm trying to think of the words, keeping patients home instead of coming to the hospital. And what can we do from a healthcare perspective to keep people home? You know, those virtual visits are one thing. All the urgent care centers are, you know, becoming more and more popular. So they're trying to keep community health at the center of things instead of bringing patients into the hospital, which isn't good for a health system that has hospitals, but it's good for ultimately the patients.
So last question that I'm going to ask, as we move into a potential uptick again, how can we as community members support you guys, you know, beyond wearing masks and making sure that we're trying not to spread the disease? You mentioned people dropping off food, but are there ways that we can be supportive now that you have some time to look at what was helpful in March?
Yeah, I think, you know, it's a tricky question because one, we've learned that, you know, the food delivery it's great, but it's not ideal because you're looking at, you know, we now have very strict guidelines around that. Everything has to be individually packaged. It has to be prepared in a food safe kitchen. So there's a lot of regulations around that now, so that because some of the outbreaks that have occurred in healthcare systems is around staff sharing food in break rooms. So we have to be mindful of that now. Pizza, like you say the word pizza in the hospital and all the leadership cringes. Like pizza is banned from the hospital pretty much because we don't want people sharing food. So I think just being supportive, you know, whether it be, I love all the like hearts and signs that we see when we drive around town. The social media posts are great. I think just being there, and maybe if you know a healthcare worker, just reaching out to them and saying, hey, how are you doing? Asking them specifically how things are going and what you can do to support them goes a long ways. There might not be anything, but just knowing that somebody is there and caring for us is a huge, huge help. Wine delivery is always an extra bonus.
We'll have to get your address and your favorite blend.
There was a little thing that was going on for a while. I don't know if anybody experienced it. It was called, I think, Wine Dash, and people would leave like wine or chocolates or all different things on people's doorsteps. And then there was a kids one that was going on for a while. So we got lots of gifts for a little while, which was very nice.
That's great. Any last questions for Melissa, since we have her?
I just want to, not a question, I just want to say thank you very much for this today. And have to say, as you were telling your introductory story, I was choking up there a little bit, just realizing how hard it has to be dealing with families and their struggles in all kinds of situations is difficult, death particularly, and I just, that was very moving. And so thank you for being here today and doing that.
Absolutely. Thank you so much for having me. It was actually very rewarding to share my experience. This is the first time I've really shared it to a kind of group of 3 strangers, at least. 2 of you are not strangers, but I can tell you I was very nervous. Ask Laura and Jess. I was emailing them frantically and was very nervous about this, but you all made it very relaxed and welcoming. And I think it was very therapeutic to share my experiences and be heard. So thank you so much for that.
I echo Russ's appreciation. So thank you so much, Melissa. When you were talking about just family members and what you guys were doing to make sure people weren't alone in their last moments, I definitely was feeling choked up. And I just remember, you know, when we were in the really thick of this and thinking about those people. So I appreciate the effort that you and your team made to be with people in their toughest moments. That means a lot. And I appreciate your authenticity and sharing your story in a really genuine way.
Thank you.
I think that's really important. So thank you so much for joining us today, and for everybody who's able to join us. We will be sending a really short evaluation form so you can share just your experience with being in this call. And even if it's really great and you loved it, please do, because we will use some of those quotes if we need to for testimonials for future sessions. So those are always helpful. And I would be remiss if I didn't mention that our next session is going to be in late January on the, I'm looking at my notebook, on January the 25th. And that is a political outlook. We have 2 fantastic speakers. One of them is Mike Knappich, who is the Government Affairs Vice President for Baystate and does all the lobbying for the hospital system. And gosh, looking at money issues and things like that is, I know, going to be important coming into the new year. And then a former colleague of mine, Tiernan Sitterfeld, who is the Vice President for Government Affairs for the League of Conservation Voters. And she'll give us a perspective on what's looking like in DC with a new political landscape there as well. So looking forward to both of those speakers. Thank you all for being here. Thank you to Melissa.
Thank you, everyone, very much.
Thanks. Really nice to meet you.
It was great.
Nice to meet you all, and thanks for sharing with us. I really appreciated it.
Absolutely. Nice background, Bart, by the way.
Thanks.
Isn't that great?